And what that extra piece of tape is for is actually the label. So you don't see it, but it should say date, time, and initials on here when that dressing was last changed. Okay? If there is no date, time, and initials on your dressing, it automatically becomes time to change it because we don't know when it was done last. Okay? So I'm going to go ahead and put my clean gloves on. And I'm going to take this dressing off. There are a couple of different ways that you can take off the tape on these wounds. The principle being that you need to take the tape toward the wound. If you're pulling away from the wound, you can actually pull that wound apart even further. So you need to pull your tape toward the inside of the wound, so from the outside periphery toward the center of that wound. When you're pulling the tape up, you need to hold on to the skin, and it's kind of difficult to do on mannequins. It just doesn't come naturally, but on a real person, hold on to the skin as you're pulling the tape up. You can either fold this tape under onto itself. We don't want you folding it under so that it's all the way touching under the ABD pad, but just so that it folds just directly onto the tape. Okay? This one here, you can actually fold back so it's circling up. Okay, and let's see, this one's barely on here. And I'll show you the rest of them on this side. They should have used a little bit more tape on this one. Okay. Okay, and again, you can fold it underneath so it's only on the tape. Okay, so I have all of the tape off of the dressing, and I'm going to pick this dressing just straight up, okay? I'm going to look at my ABD pad, and I'm going to look at whatever kind of drainage is on there. So I want to describe it. When you go to the other side and go through the stations, you can look at that. It's going to be serous, serosanguinous, it might be a minimum, moderate amount, it might be purulent drainage, however you can describe it. Is it malodorous? We want to describe that as well, okay? I recommend you keep this dressing in your hand so that when you pull out the packing, you can set it right there and you can easily view it. So I'm going to now pull out the gauze packing, which sometimes this is painful for patients, so you do want to assess that as you go through. So I'm going to pull out the gauze packing, and I'm going to put it right onto my dressing. That way I can see, okay, well, we've got one 4x4 in here. There's not anything more than that. The drainage, again, what is the color? What is the odor? What is the amount that's coming out of there? Okay? So I can easily see it instead of kind of draping it across the patient's bed and it drips all over it, and it means a new bed change. Okay. Another nice way of doing this is once you've kind of pulled out all that dressing or that packing, is I like to just kind of roll it onto itself, put it inside of my hand, and then pull my glove off on top of it. It's a nice way of kind of containing the drainage, containing the smell, and that this can easily go into the trash can. You know, we don't want patients' family members coming in and looking in the trash can and being kind of grossed out from that. So it's kind of a PR, it makes a cleaner environment. So this is a nice way of doing it. Sometimes you're able to, if the dressing is too large, you're not able to. If you're not able to, later after you finish the dressing change, you're going to take that trash bag out and you're going to change it so that there's a nice environment in your patient's room. Okay. So I've just taken off the dressing. I'm going to go ahead and put another pair of clean gloves on. I'm going to put these on so that I can assess the wound. When I look at this wound, I'm looking at the inside of the wound, and this particular one here to me looks kind of red, and it looks kind of beefy. And that is actually a good thing. I don't see any exudate coming out of it. I don't see any eschar. It looks like good granulation tissue. Okay. I'm also looking at the peri-wound area, so that's the area around the wound. And so you want to look for any excoriation. This one looks a little pink, which is a part of the normal healing process. Okay. You can assess for temperature with the back of your hand in the area surrounding the wound if you want to, because you've got gloves on. Okay. After you do that, you want to go ahead and measure the wound. You're going to measure the length, the width, and the depth. You don't do this every single time. Different protocols at different facilities. It might be once a day. It might be every couple of days that you're doing the wound measurement, but we'll show you how to do that. So I'm going to take my sterile cotton tip applicator, and then I have my measurement tool right here. And I'll tell you, my measurement tool is not quite long enough for this wound, but we'll proceed on. So if I just hold this cotton tip applicator over the wound and put my fingers to make the measurement, I'm going to hold it over here. And actually, It's about 15 centimeters in length. And then I'm going to do the width, and you want to go to the widest part. And the width is, let's see, 3 centimeters. And then we want to do the depth. And when you're going in to do the depth, you want to do the deepest part of the wound. Okay. And again, measure that. And that looks like 2.5 centimeters. Sometimes you can visually look for any tunneling, or you can take your cotton tip applicator and you can kind of push on the side surfaces to make sure there's no little pockets that follow underneath the skin that you're not able to see, because those will need to be packed. Okay? When you're finished with that, you can go ahead and take off your clean gloves and throw away your cotton tip applicator. Okay, the next step is you want to set up your materials that you're going to need for your dressing change. I highly recommend that you set these up in the order that you're going to be using them. That's going to decrease your risk of becoming unsterile through the procedure. So the first thing that I'm going to use is I'm going to use my 4x4 gauze, then my ABD pad. I'm going to put my saline up here. I'm going to get my tape ready, and then I'm going to set up my gloves in the back. Because I want to, I'm going to be putting this tape onto somebody's wound, which is a portal of entry, right? I want my tape to be nice and clean. So sometimes these table surfaces are not the best surface. So if you just take your piece of tape and actually kind of create a working section, so I've just put it long ways, and now I can put my tape on top of the tape instead of on top of the table. So I'm going to kind of guesstimate how long my tape needs to be. And I'm going to get 3 pieces prepared. So I'm going to need 3 pieces of tape. If you want to do 1 extra just in case, that's fine. And then I'm going to do 1 small piece, and that's for my date, time, and initials. And you could go ahead and get it ready at this point if you wanted to. Okay. So I've got my 4x4 gauze here, and I'm going to open this up. I need to open this in a sterile method. Your book recommends pulling it from the far side and pulling it toward me. If I pull it this way, I will not cross my sterile field. Okay? Some people will open sterile packages in this manner, and if you can see, I would cross my sterile field as I opened up that package, correct? Okay? So I want you guys to look. When you go into surgery, which you'll be able to do in 212, I want you to watch how they open up sterile packages. They usually will open them up away from them and then toss them onto a sterile field. So look at that so that you can learn from their behaviors on how to open up packages. So I'm going to open my sterile package away from me. And I personally like to take that top all the way off, and that way it's not just kind of hanging down and my hand can hit it. I just pull it all the way off, and then I've got an open package that I can work with. So I'm going to put that top in there, and I'm going to set down my 4x4 gauze. So the inside of this package is sterile. This outer rim is our 1-inch border, so we don't want to touch that either, okay? Once this package is open, I don't want to be moving over my sterile field because that's going to contaminate it. So you need to be very mindful about crossing your sterile field. Next, I'm going to open up my saline. So I have a fresh bottle of saline that I'm opening up. Take off my wrapper, okay? And I'm going to open my package. So we need to keep this sterile for 24 hours. So the inside of this cap needs to stay sterile. So we can't set it down on the table that way. You can either hold on to it or you can set it down with the cap open facing upward, okay? I'm going to decant some of the fluid out of this sterile container. I want to put my hand covering the label, and I'm going to decant into the trash can just a small bit. And what that does is it cleans off the lip of the container. The reason I have my hand over this is, as you know, sometimes when you pour things, it drips down the side of the container. And if it drips over the label, we're not going to be able to see what it is. Okay? So I'm going to take it with my hand over the label, and I'm going to decant a small amount into the trash can to clean the lip. After I've decanted, I'm going to pour into my 4x4 gauze boat, and I'm going to saturate my gauze. It doesn't matter if you put too much in there, it won't make a difference. I'm going to go ahead and recap my saline, maintaining sterility of that, and I'm going to put that away. Next, I'm going to open up my ABD package, okay? And this one gets a little tricky. If you don't hold on to the gauze, if you don't hold on to the ABD, it can kind of pop out of the package. So you have to be kind of careful as you open this. So I'm going to do the same technique as reaching away and pulling toward me. Okay. So I'm going to hold on to the package, and I'm going to pull I pull just a little bit to get it started, and then I resituate my hand so that I'm reaching through that plastic to hold on to that ABD, so it's not going anywhere. It's not going to jump out of the package. And then I'm going to pull off the rest of that paper top. Okay? So that can go into the trash, and I can set down my ABD pad. Okay. Next, I need to put on my sterile gloves. So take a pause, take a moment to think. Do I need to do anything else before my hands become sterile? I've got my gauze ready, I've got my ABD, I've got my tape ready. I don't think I need anything else. It's safe to go ahead and put my sterile gloves on. Okay? So I tend to move to the end of the table so I can keep an eye on the sterile field, and I can also keep an eye on my patient. I'm going to go ahead and open up my sterile gloves, I think. We're going to adapt. Okay. So I've got my sterile package in my hands. Again, you don't have to hang on to them so dainty. Go ahead and open up your package. Go ahead and hold on to the tabs in the center and pull those gloves open. Now, if I'm at the end of the table here, it works really nicely that I can kind of use this table to kind of make it so that the paper will stay open, and it actually tends to work extremely well. I'm going to fix this fold so that you can see. Okay. Okay, so I'm going to put my sterile gloves on. So I'm going to grab near the cuff, and I'm going to get my hand inside the glove. I'm going to slide it on with my palm up. Okay. Now I'm going to go put my second glove on. I'm going to get 2 fingers, my second and third finger underneath the cuff. Again, I'm going to lift it up so those fingers are not hanging down and hitting surfaces. I'm going to get my hands inside the glove, and then I'm going to slide my glove on with my palm up. Okay. So now that my sterile gloves are on, I can touch my hands. Now you'll see that this cuff is not down all the way, and that's absolutely fine. You could put 2 fingers inside here and pull that down if you want to. I find that I usually mess it up, and so there's no reason for this to be sterile, so I'm fine to go ahead and proceed. Think about ways that you can minimize messing up your sterile technique or not maintaining sterility. Okay, so my hands are sterile. They need to stay above my waist. They need to stay in my vision at all times. I'm going to go ahead and clean this wound first, and then I'm going to pack it. So what you want to do is take a piece of gauze, a piece of 4x4 gauze, okay, and I'm going to squeeze it because these are pretty saturated. I don't want to have it dripping all over my patient. If you take this piece of 4x4 gauze, and this is just how it was in the package, it's just like this, and I'm going to actually make a wonton out of it. So if you take it corner to corner and then corner to corner, you have like a little wonton. And the whole reason for doing that is as you go through to clean it, it kind of protects your hands so that your hands aren't touching inside the wound, that it's just the gauze that's touching the wound. So I want to start from the cleanest part of this wound, and that's going to be the top, and move down. So I'm going to do one swipe, and you always start from the center and work your way out, except for Foley catheters. That's the only difference. So you're going to start at the top. You're going to go down with a little bit of friction, one swipe, go straight into the trash can. Okay? You're going to do a second gauze. Again, you have your square. You're going to make a wonton, corner to corner, corner to corner. And now I'm going to go my outside on the farthest away from me. I'm going to go one swipe from the top to the bottom and throw that straight into the trash. I'm going to take my third and do the same thing. So I have my square, make my wonton, corner to corner. I'm going to do the outside portion from the top to the bottom and right into the trash can. Now I'm ready to pack my wound, and I'm going to grab another piece of gauze. So I'm going to take my 4x4 of gauze, and I'm going to squeeze it out. If you take that gauze and you put it right into the wound like it is with a lot of water on it or a lot of normal saline on it, when you go to change that dressing the next time, it's just not going to absorb that exudate. So it's almost like you get this little puddle of exudate at the bottom of your wound, and it doesn't do the job. It defeats the purpose. So squeeze it out so it's just moist. And now you want to go ahead and open up this gauze all the way. It's like these little, you're exposing all these little boxes in here, and I always think of these little boxes as being little hands that are going to grab onto the exudate, and then as it dries, it's going to pull it all in. So I open my gauze up all the way, and I'm going to pull it in together so that it just stays nice and loosely packed. I tend to kind of fan fold it into my hand. You don't have to do that. You just want to kind of pull it together and let it set into your hand. You could even just, so that it stays nice and fluffy. The fluffy is the point of it. You want to fan fold it, that's fine. You want it in your hand so you're in control. And I tend to take it through a couple of fingers just so I can feed it in nicely. But there's many different ways of doing it. So I'm going to start packing this into my wound. And in this case, I'm just going to use my hands to do this. And you want to cover all of the wound surface bed. So you want to make sure you're getting into all those little nooks and crannies. Okay? You don't want any of the gauze on that skin that's on the outside. Think about what your skin looks like after you've been sitting into a bathtub for a long time and how your fingers get all crinkled. That's the same kind of thing that you're going to do to this patient's skin if you have something wet sitting on top of their skin for, say 6 hours or 8 hours between dressing changes. I'm going to go ahead and show you one more piece of gauze just to show you. So I'm going to take that one. I'm going to squeeze the fluid out. I'm going to open it up. And if you notice while I'm opening this, and sometimes when I'm doing the dressing, I'll just kind of step back a little bit. So as I'm opening this, I don't have to worry about it hitting anything on my table, hitting my patient, anything that might be in the way. Okay? So I'm going to open this gauze up. Okay? Just going to have it nice and fluffy sitting inside the hand. I have complete control over it. And then I'm going to pack the wound. Okay, and feed it in there. So we're going to touch all parts of the wound bed. On the mannequins, they tend to take about 1.5 gauze. So if you want to just practice with one, that's fine. You want to make sure all the gauze stays right inside the wound and it's not on the outside skin. Okay, so now the gauze is in there. Now I need to put the ABD pad on there. I still need to maintain sterility. So I want to grab the ABD pad and I want to grab it from the outside. It's kind of like a diaper that it has that blue stripe on it. So I'm grabbing the outside surface and they always stick like this. So none of the shaky stuff like we did with, you can't do that with linen, you can't do it with a dressing change, okay? So you need to actually fold this open with your hand. So just touching the outside surface of the gauze, you're just going to pull it open, okay? And now you want to lay this directly on top of the wound, and now your wound is covered, okay? At this point, if you are not going to be exposed to blood or body fluids, you can take your gloves off. If you are going to be exposed, you need to leave your gloves on to put the tape on. Sometimes you're doing dressings where you're kind of holding on to it and still putting the tape on, and so in that case you need to leave your gloves on. So I'm going to put my first piece of tape on. It's nice if you can kind of make a little tab on one end of the tape. It makes it a little easier when the tape comes off. And I'm going to put one strip straight across. Okay. I'll go ahead and put the remaining strips on. I am purposely putting these across the abdomen in this fashion instead of making like a windowsill type of taping on it, because this is a surface that bends.